Thank you, Governor, Director, and colleagues. Good afternoon, everyone. I hope you were able to spend some time with loved ones for Mother's Day this past weekend, both for the mothers who are here and for the mothers that we honor as well. Also, I'm excited to have colleagues join us, Dr. Onmont and Dr. Holland. Both are pediatricians, with Dr. Onmont being a great partner of the Rhode Island Department of Health for many years. We're fortunate to have him in Rhode Island and look forward to hearing some of his wisdom and perspective today. And also Dr. Sabina Holland, who is a pediatrician and pediatric infectious disease doctor, a very dear colleague to me as well. I've referred to her as a superstar, so we are thrilled to have Dr. Holland up here with us as well to talk about the exciting news that happened this week with the expansion of COVID vaccination to our younger population. So as we always do, turning to our data, we are still in a stable place. Our weekly percent positive figure is 1.5%. That's down from 1.6% the previous week, and our number of new hospital admissions for the week dropped to 81 from 117. These numbers and trends are not happening by accident. They are intentional based on the tremendous work that we're all doing and need to contribute to. It's important to know that with testing, treatment, and vaccination, the trends we are seeing are a direct result of what we're doing, especially with the vaccination that we are doing. When we as a state vaccinate more people, our case numbers, our hospitalizations, and our fatalities drop. And when you as an individual get vaccinated, the chances of you having a negative health outcome from coronavirus that causes COVID-19, the chances of that also drop. So it's talking about what happens at the state level, but making sure that you are equipped with understanding the tools at your fingertips to help make sure that you stay protected as well. The flip side is, if you do not get vaccinated, your chances of having a negative health outcome from coronavirus causing COVID-19, those chances increase. With the more other individuals that are vaccinated and you still being left unvaccinated, you are then more susceptible to getting infected from this coronavirus. Over the last year, COVID-19 has changed. It has evolved. The original virus that causes COVID-19 has been replaced with newer versions of that same virus. These newer variants are aggressively searching for people who are not yet vaccinated, those who are susceptible that they can still impact. This is precisely why we have seen our proportion of cases among children increasing. When the virus encounters someone who doesn't have protection from being vaccinated, people are often experiencing more serious health outcomes. As Dr. Phil Chan shared last week, and thank you to Dr. Chan for stepping in so valiantly as he always does, half of the people 75 and older in Rhode Island who get COVID-19 and who are not vaccinated are now ending up in the hospital. Think about that number. 50% of people 75 and older who get infected with coronavirus and who have not yet been vaccinated are at risk of getting hospitalized. There are some people who want to wait for quote-unquote herd immunity in order to protect them, so that they don't get vaccinated but let everyone else get vaccinated and have that work for them. I want to really correct that. Herd immunity is a concept that we in public health use when thinking about populations, at the statewide level. That concept is not applicable to you at the individual level. If you are not vaccinated and you are exposed to someone with COVID-19, there is a very good chance you will get sick. The variants that we have are more contagious, and they're showing that they are also more severe. And the truth is that any one of us could be exposed to coronavirus on any given day. And what determines the outcome are those who are vaccinated and protected and those who are not. Rhode Island is a small state, we know that. And we're still identifying more than 100 new cases each day. So coronavirus is out there, the variants are predominant at this point, more contagious, more severe, and they're looking for the individuals who are not protected or vaccinated. It's also important to know that you can't wait for immunity because it's not just going to come to you. It's not just going to happen from the people around you. The way to become immune is to get vaccinated, and particularly to be immune against the type of variants that are spreading now. In addition to really correcting that understanding about herd immunity, I also want to correct the understanding about natural immunity. Many people are saying, well, I was already infected with COVID-19 and so I'm protected. The key is understanding that if you were infected with COVID-19 a month or a few months ago, you may not be immune to the versions of the virus that are circulating now. We are looking at data constantly and seeing how significantly it has changed and how predominant the variant forms of the viruses are now compared to even just a few months ago. And so the best way to get protected against what's circulating now is to get vaccinated. That natural immunity only protected you against that one type of coronavirus that you had at the time, and it's pretty much guaranteed that the newer, more severe variants are what's present now and what you would be exposed to and not have any protection from that natural immunity. Maybe a little bit, but not what we need. So we really want everyone, whether or not you have had coronavirus, been infected, had COVID-19 in the past, you should get vaccinated now to be protected against all forms of the virus that are present. The bottom line is that wait and see approach for vaccinating does not work. It's not going to protect you, and it's what I want to strongly urge you to change. Shift that understanding and go get vaccinated to protect yourself and to protect your loved ones so that you can avoid getting sick altogether and avoid the increased risk of a more severe illness and potentially hospitalization. If you had COVID-19, you still need to get vaccinated. If you're unsure about getting vaccinated, please hear my plea to you. Protect yourself and protect the people you love who are around you by getting vaccinated. Now is the time. Now is the time. Some great news we have is that we can now offer that same protection to our children who are years 12 to 15. Rhode Island is a national leader in childhood immunizations, thanks to providers like Dr. Onmat and Dr. Holland, among so many others that we are blessed to have here in Rhode Island. Now we have the chance to expand that success with COVID-19 vaccine, knowing that we can now vaccinate children 12 to 15 years of age and then older from there. The Pfizer vaccine was rigorously studied before it was made available to children 12 to 15 years of age. And we are doing ongoing monitoring after administering more than 100 million doses of this same Pfizer vaccine to adults across the US over the last 5 months. On top of an ongoing safety review, Doctors and researchers also studied its effectiveness. In clinical trials, this vaccine was 100% effective at protecting kids from developing symptomatic COVID-19. That is tremendous. To all the parents and families out there, this is a way to help keep your child, your loved ones, healthy and safe. It's also a way to help keep your child out and about, enjoying themselves with friends, in summer camp, in an athletic activity, and doing the things that kids love to do with less of a concern about the quarantining and all that's involved when someone is infected with COVID-19 and is not protected. We have some new frequently asked questions online about COVID-19 vaccine for kids at covid.ri.gov/kidsvaccinefaqs. And we are going to continue working to get information out to parents and families in a variety of forums, including today and beyond. Something else I want to mention briefly today is summer camps. We are asking people who will be operating summer camps to register those summer camps using the Rhode Island Department of Health Summer Camp Registration Form by May 30th. To access that form, go to reopeningri.com. The information you submit will be very important should we need to do contact tracing or do any other follow-ups. Summer camps are going to be great this summer. We're all going to have a great summer. That has been our goal. But to make that happen, we need everyone to get vaccinated. So thank you for heeding our plea on that.